let's start by saying congratulations. So the way I understand it, Square Mile Dental is now the first dental practice in the UK to have 4 dentists that have graduated with a membership of advanced dental surgery. Is that right?
Advanced general dental surgery, yeah.
General dental surgery from the Royal College of Surgeons. So we basically applied for the exam about 1.5 years ago. And it's one of those things where Sanjay has been my mentor for 10 years and taught me everything I know. He's obviously done every course under the sun and been teaching around the UK and around the world. And we as a practice, we do everything. We're not just a specialized practice where we just do implants. We do everything from perio to routine fillings to whitening to across the board. And we've always felt that even though we are a general dental practice, we take a lot of pride in the fact that the level of work we do, we'd like to think that we complete it to specialist level. And that's what we've always tried and, really pushed ourselves to be. But there was no real qualification that set people doing advanced general dental surgery from practices just doing routine basic dentistry. And so we were keen to really push us and also Amit and Elaine to be able to go for an advanced degree, which really showcases that we can be a practice that's renowned for doing high level work. But for anyone, you don't need to go and see someone for implants and someone for this. We're able to do it all. So we signed up to the Royal College of Surgeons exam, the MAGDS. And I'll tell you, it was one of the hardest things that we have done. It was like 2-3 months solid, brutal revision. And the exams were, you don't know what you're going to expect. I should have known when it was part of the Royal College of Surgeons, but you think, this will be all right. But it was absolutely brutal. And it was 3-4 days of just rigorous exams and vivas. And I think Sandra would agree, it put us through our paces, didn't it?
Yeah, it was 3 days. 1 day of 2 2-hour papers, and then the next 2 days were 8 vivas on each day, so 8 oral examinations on day 2, and then 8 oral examinations on day 3. And I tell you, it's an amazing experience because it opens your eyes to parts of dentistry that maybe you don't always consider as much because you just take it for granted, such as some of the things like GDC regulations, or a bit more into health and safety, or a bit more into mental capacity. So it's actually the way it brings it all together. It's quite overwhelming at the beginning, but at the end, you can kind of see how it comes together. But it is a lot of work. Yeah, I think we all feel very proud of it. So
yeah, well, definitely. So what's the plan with this now you have this membership? What is the plan? I assume it's more than just a marketing tool for the practice.
The key is to become more and more referral based, and that's literally what it will lead us to, because it just makes you more standout. That when people need help, they can refer to us. We're a city practice, we're easily amenable. I think also from a patient point of view, it's just a case of that they know they're in good hands because of the level of qualifications that we have there. But also further to that, we're now all 4 of us are becoming examiners on the Royal College of Surgeons board as well. So we're all becoming examiners as well. We're already helping with writing some of the papers and writing questions. Early days, but it is happening.
And what this does, Seb, is it really it broadens your experience and level of knowledge, and the fact that when a patient comes in, we're now learning, and I say learning because it's always changing and improving, how to not just assess the patient's teeth, but also relate it to their medical history, look at drug interactions, are any particular medications they're having, what interactions will that have on their decay risk and their risk of gum disease. Looking forward, that when we do improve their dental health, will that have ramifications on the rest of their health? Like good oral health can improve your diabetic control. So we're now looking at our practice more as a holistic overview, with the fact that we're not just focused on looking at your teeth, we're looking at focusing as a patient as a whole and how we can improve not just their confidence with the cosmetic side, which we're known for doing anyway, but also just in terms of general health in the whole system, understanding the relationship. And that's where it really opened my eyes, my knowledge learned from doing that exam, just my knowledge base now, being able to look at the patient as a whole has really, really, really improved.
it's definitely helped you guys. It's definitely helping your practice. Do you think this is something you would encourage the wider dental profession to take part in?
Definitely.
100%. Yeah, 100%. I think it's a learning curve. It's it's not something that anyone can take lightly. Some people are better suited for sitting exams, but I think the benefit of it is huge. So, for instance, I don't do root canal treatment anymore, but my level of understanding, because I used to do a lot of root canal treatment, was fairly good anyway. But because of this, I had to then read to a very high level about root canal treatments and what the specialist can provide. So when I'm diagnosing a patient, I already know what's possible, what's not possible, what I can expect before I even enter a discussion with the endodontist, the specialist, to do it. So it gives you more depth of field. So when you're planning something, you have a far broader range of knowledge of not just what's capable in your hands, but what is the right prescription that you could give to someone. So we take a lot of complex cases on, so you can see the value of that, because we're encompassing things with different medical health problems, like we just mentioned, but also lots of dentistry that might have been done in the past, and we have to bring it all together. So being able to assess for implants, periodontology, root canals, root canal treatments, teeth that are savable, teeth that aren't savable, we can actually put it together as a package deal now, very, very confidently, but have the qualification to back it up anyway. We were doing it, but now we have. I suppose it's a really nice thing to have under my belt. I've always wanted letters after my name, and I feel very proud to have that. And especially to be associated with the Royal College is a big thing for me.
And also for dentists, not just young dentists, but general dentists out there, I think we all know that we're facing a ever-aging population. More and more patients will have more complex medical histories. We're seeing a rise in diabetes, we're seeing a rise in obesity, we're seeing a rise in blood pressure complications, and all of these things which will continue to happen, and more pharmaceutical medicines than ever before. And every year, if you look at the BNF of medicines, it's doubling in size, and there's all these fancy names that you see when you see a patient's prescriptions that you're forever having to Google. And I think for dentists out there, it's going to be a minefield for litigation, and also how to give the patient best level of care. So doing something like this will give you the grounding to help you avoid problems and better be able to treat the patient as a whole, to hopefully avoid, lawsuits, hopefully avoid mistreating the patients, and just giving you a more wider perception. We tend to, as dentists, we get very focused in on, smile makeovers or whitening or how to do implants, for example, but this is just bringing you back to basics and what we were taught at university many years ago, to look at the whole picture.
I mean, you just touched on it there, Nick, but why is it so important to surround yourself with good people and qualified people in dentistry?
So our profession can be quite lonely. We're in our room with a hardworking nurse, and you don't, if you isolate yourself, it's quite easy to get stuck in a rut and do the same thing for 10, 15, 20 years. And yes, you might get the financial reward, but do you get the personal satisfaction, and are you growing? And if you're not getting that personal mastery and growing in your career, then it can be quite stagnant. And we're lucky that we see dentistry as such a beautiful profession, and we're always surrounding ourselves with like-minded professionals that if there's a case where I feel I could have done better, which often there is, I will email Sanj, Amit, or Elaine, or send a picture, and we discuss the case, and they give their opinions, and we're always able to share and therefore improve, so that we don't make that same mistake again. And we're always making new mistakes and learning as we go on. And that means that there's always a challenge in dentistry. There's always a buzz about it. And I think that's the key thing. You've got to surround yourself with academies such as British Academy of Aesthetic Dentistry, Dentinal Tubules, being involved with publications such as Dentistry. You've got to make sure you know what's going on. You've got to be able to surround yourself with people that can push you and, lean on when you're in trouble. And that way, it just doesn't feel like a lonely profession. I know a lot of people that had a hard time during COVID and thought twice about their career. And that was never on our agenda. We couldn't wait to get back.
What does it give us? I think it gives us a new gold standard in the team. So we are like a dream team. That's how we try and see ourselves, that we've got something that is something for everything. So I suppose there's 4 real criteria. We've got a level of expectation that people expect of us as clinicians anyway. We've got a high level of skill, which is now proven not only clinically, but also academically. We have the mindset to achieve it. And most importantly, we always want to push our boundaries so that we can set a new standard amongst ourselves and for others as well. I think that's really important.
So this may well inspire dentists to go out and to explore a further education that they could do themselves. Is there an argument to say that dentists can be overqualified, or do you think education is something that is a career-long thing?
I think that's a great question. I don't think you can be overqualified, because what happens is you can do lots of courses. This is what I was guilty of, just doing like so many courses. I invested hundreds of thousands of pounds in education, but with no formal letters after my name. So it's almost like it was a shortfall for me not to have some formal letters after my name. But you still have the qualification, you still have the knowledge. The difference is when you have a formal accreditation, you've had to prove yourself under exam conditions, which means you've had to learn it, but also show that you've learned it, rather than saying, I've just done this course. So I would say you can never be overqualified, because your knowledge never stops. We're always learning. If you ask us now, we'll talk to each other, and we're all learning off each other continuously and from other people. We're still doing courses all the time.
Okay, perfect. And would you encourage people to undertake this program?
100%.
Yeah, 100%, without a doubt.
It's a commitment. If they've got other things that they're doing at the same time, I'd probably say don't take it on until you've got time to commit to it. But when you actually do commit to it, go for it. It will make you better, for sure.
Great. Is there anything else that you'd just like to add?
So the other thing that I wanted to kind of just talk about was just journeys. And we touched on the fact that being surrounded by good people, but what I also didn't mention is career pathways. You know, I've got a lot of dentists that come on our teaching courses that we do on onlays and composites and various bits and on our diploma. And they're always asking about career advice, how long to stay in a practice, when to start including some private days in and around their NHS. Some dentists want to make a transition from NHS to private. Some people are happy in a mixed practice. And I think where we've been very passionate at Square Mile Dental Centre is making sure that we're always doing what we can to improve our own skills. But the key thing about our practice is we accept every type of treatment at our practice. We try not to have to rely on referring out. We generally get very complex cases referring in. And it's a practice that you've got a certain amount of pressure working at Square Mile, especially with Sanjay at the helm, that you never quite feel like you plateau. And that's what I say to other dentists. If you're at a practice and if you feel like you're not progressing, if you feel like you've hit a plateau and there's not the learning framework or the teaching framework within the practice, if you're not getting opportunities to do the type of work that you want to do, then, you know, there's always time to consider about career changes, but you've got to be worth that change. And that's the thing that Sanjay always taught us. Don't just try and charge more because you can. Don't try and just do more treatments and more complex things because you want to. If you're going to make a step up in your career, do the courses, do the qualifications, spend time documenting with photographs, create the portfolio. And when you feel like either your principal won't buy you the materials that you need, if you've shown that you've improved and you've shown that you've increased their profits, only at that point are you then ready to maybe take the next step. Don't just think you can just go above and to another practice and life will be rosy. You know, at the end of the day, now being a practice owner, I understand that there's a lot of costs involved that the associates don't see. And whilst I'd like to think that we're very liberal in what our associates can buy, we do make sure now that it's rational. You know, we've got to be rational. It's got to be reasoned and measured to be able to afford the investment. So I think, you know, spend your time at a practice. Don't leave a practice after a year. Try and be there for 3-4 years. See how your work lasts, see how it fails. Show your principal that you're improving. Show your principal that you're improving the practice profit and the patient care. And then if they return you in kind with the right materials, then it's a practice that you should stay for many, many years. And only at that point, if it's not, that's when I think you should look to move on. And that's always been our values at Square Mile. We want dentists to really feel like they never hit a plateau, and hopefully that we go on to continue doing that.